I wonder sometimes if we are at our peak, because there are older doctors who are amazing at what they do, but I think there's also a fear that you've seen so much that you make decisions based on what you know and less based on evidence-based medicine. I think that's like a risk I think that doctors run. And I do like to think that we're at our sweet spot right now.
Welcome to How I Doctor, where we're bringing joy back to medicine. Today, my guest is Dr. Kaveh, a practicing gastroenterologist and hepatologist at the Permanente Medical Group, where I also practice. Dr. Hoda is a fellow podcaster, running the House of Pod podcast for over a decade, I think, covering a mixture of healthcare, humor, and medical news, and I think was the first podcast I was ever on as a guest. I'm excited to talk to Kaveh today because he is a mixture of thoughtful and funny, which I think is the best Dr. Pokemon subtype. He's a fantastic musician. And most importantly, when you Google him, one of the top links is the poop question GI doctors are tired of hearing. Welcome to the show, my friend, Dr. Kaveh Hoda.
Oh, thank you for having me.
Kaveh, we've been meaning to speak for a while. Thank you for gracing us with your presence. We were talking and thought we could go in a billion directions, but I thought we'd actually cover being a mid-career physician. I think it's actually a very different challenge, and it's probably like the least discussed decade or segment of people's careers. And you and I think, are both in that mid zone. We're mid.
We're very mid. I'm very mid. No, you are absolutely right. It is a very interesting time, and you're exactly right. I think it's something that isn't discussed. And you either think of your career in terms of like, this is my career when I start, when I'm going through, or when it ends. And this is that big chunk in between where a lot of people are, and we're not discussing. We're sort of in a weird sandwich generation too. We were still using eponyms when we trained. There was still probably farm reps at the beginning of our training. So we were sort of the in-between generation that saw that sort of that, I hate to get generational about it, but like, Gen X of medicine, So it's a very interesting time to be practicing and to be a physician.
It's a good point. I know what a paper chart is. Or I was in that transition time.
Yeah,
like in med school for me, I started med school in 2003 to 2008. And so we were mostly on paper still. And when we would round, I would carry my paper in my white coat. But we also had some stuff in the computer on the EHR. I remember I have this idea in my head that somebody said once that the best doctors are 8 to 10 years out of residency because they have enough experience under their belt that they've seen a lot of stuff. And so they've got that experience, but they're not so far away from their medical training that they're very antiquated in their practice patterns or whatever. And I feel like this mid-career thing, I'm no longer in that 8 to 10, not like an old timer doc, but I don't feel like I'm that 8 to 10 level either.
Yeah, I absolutely agree. But let me ask you, do you feel like you're at the height of your, doctoral power at this point? Do you feel like this is the best because you watch chess players, for example, and chess players, you think on some degree, as they get older, they just get better. But that's actually not the case. There is a sort of a peak where you're at your ability to concentrate. You're at an age where you've learned everything you need to know, or as much as you're going to, and you're at the peak of your concentration powers. And then there's sort of a decline after that. I wonder sometimes if we are at our peak. Because there are older doctors who are amazing at what they do, but I think there's also a fear that you've seen so much that you make decisions based on what you know and less based on evidence-based medicine. I think that's like a risk I think that doctors run. And I do like to think that we're at our sweet spot right now. But I don't know. I'm curious to know if you feel that way.
I don't want to be the doctor that people look at and think oh, what an antiquated way to do things, to approach a condition. God, is he still practicing the way he did in residency? Because that, if it's residency was 30 years ago, the day before somebody retires, it's I don't think I want to. I hope that I've kept up and I've changed my practice some. I think that's the push and pull. We're in between the older docs and the the new grads, and I even work with residents and medical students some as well. Do I listen to the way the residents are now managing things, or do I use my own experience and say, no, I think I'm actually the way I'm doing it is the quote unquote right way to do things because I've got experience under my belt that the residents don't have. What do you think feels the most different between now and 10 to 15 years ago?
Technology goes forward, and there's always that. There's always new technology, and there is new things to learn. There's a lot more out there every year. There's more out there. You can see it. People have shown like how the USMLE prep books increase in size every year. There's more. There's more to learn every year. I think in terms of culture, I like that we're less of a top-down patriarchal sort of medical world now. I like that there is a more of a flat balance, and there's more 360-degree sort of approach to taking feedback, and how there should be. We're getting closer to where we need to be in that regards. And in the best way to avoid, medical errors, and the best way to practice medicine is being approachable and being able to get feedback from everyone involved in the healthcare system. And I think we're closer to that. Not there quite yet, but I think we're definitely better than where we were. In terms of the downside, the allure, the mystique, the respect of medicine has dropped. There's no doubt about that. And that was happening even before COVID, and before we were held up briefly on a pedestal as heroes to be taken down as villains of whatever is the latest contemporary conspiracy theory. That's probably the shift I saw. But we also did see that coming. My father was a doctor. We knew plenty, both of us, older doctors who would tell us stories about, doctor lounges, going to a restaurant and saying you were a doctor and being automatically ushered to a good seat. Those days had already gone by the time we had been practicing. But that trend sort of continued a little bit. And I think it's a good and bad thing for that too. Doctors shouldn't consider themselves higher than everyone else. It makes us probably a little bit more likely to base our whole identity around medicine. And now people like us in our mid-careers, we're facing questions, and we're probably going to talk about this, that older generations probably didn't, because we don't base our whole identity on medicine and being doctors,
I'm happy for the paternalism piece to go away. I wish it wasn't like the trade wasn't for some villainization. Like I think
Right.
I
Yeah.
would have rather it been more like just humanization. That it's like, okay, yeah, we're not perfect, but we're also not villains. Did you have any urges over your illustrious medical career to kind of break up with medicine or stop practicing?
No, not completely. I do enjoy what I do. I do think it's great, but now we're in our mid-careers. We've gotten pretty good at what we do. The medicine is always changing. That's fun. And there's always new things to learn. And you do have to embrace every now and then the medicine itself, and remember what you love about it. But you also get pretty good at it. You've done it for a while now. So you do want to explore different things. So there has definitely been things I want to explore outside of medicine. And I think that's a big part of being a mid-career physician, is sort of questioning that. I have never been fully tempted to leave medicine completely. I don't think I ever would. Even if, for example, the podcast were to blow up and take me to that level where I could, I don't, and it won't for many reasons, but no worries, people. We're all good. That's not going to happen. But like, even if for some reason it did, I don't think I would take it, because I think what makes the podcasting interesting is that I'm actually practicing medicine. And once you step away from that too far, I think that my identity as a podcaster would change. So I'm curious to hear your thoughts about this, because you've always been able to operate in multiple different worlds: business and medicine, entertainment. You've done a little bit of everything. I'm wondering about if you would do it, if you felt like you would ever get to a point where you would leave medicine completely.
There was a time I thought about it during COVID where I was just like, very crispy. So I've definitely considered it, but I think the point that you made is really good about the medicine piece of medicine sometimes can get a little monotonous. I remember my program director in residency saying like that, he's probably maybe 5 or 10 years more senior than I am now. And just like he was kind of bored by appendicitis. And he's like, yeah, I've seen a lot of those. It doesn't do much for me anymore. And I was just like, no way, there's always going to be something. And I agree with you. I think the mid-career physician needs the opportunity to expand their life in some way. We dedicated so much of our 20s and 30s to this profession and this career, and we gave up our youth and our weekends and our holidays for other people, which is wonderful. But I think this is the time that people kind of want to try something else, and that might be professional development to expand their medical horizon. That might be just time with their family. If they want to grow with their family, it might be a podcast, it might be a business, it might be a hobby, it might be travel, whatever it is. I think people now feel comfortable enough with the medicine that they're like, what else is there in the world? Like we're fully able to take the blinders off and be like, oh wait, I'm allowed to do something else with my time. Hey, if you're a physician who's tired of feeling undervalued, underpaid, and let down by your employer, then join us on Off Call. Visit offcall.com and sign up today. Just like Mark Cuban is bringing transparency to pharmacy prices, Off Call is bringing transparency to physicians and our careers. Thousands of doctors sign up for Off Call to get accurate, reliable, and trustworthy data about new jobs so they can advocate confidently for themselves and ensure their pay actually reflects their worth. So join us. Visit offcall.com and sign up today. It's time to take back control of your career.
Absolutely. You're exactly right. I mean, we all at this point see that we see the rest of our lives unfolding, and we recognize that there is a finite amount of time left for us, and everyone starts to wonder if they're doing exactly what they want. And we all kind of go through, for lack of a better word, some degree of midlife crisis. I think what's different now is, since we no longer create our whole identity as physicians, that gives us other opportunities. And some people, like you said, may just decide to refocus into medicine, whether that's being part of administration, whether that means learning new skills in medicine.
Yeah, getting a new board certification or something. Yeah.
Yeah, I mean, I don't know. I imagine in the past this happened, but because people had different outlook on things, that's like why older doctors would then leave their wives of like 30 years, 20 years for like a young like student or nurse or something like that. I feel like nowadays people, instead of doing that sort of thing, are like, okay, well, maybe I need a podcast. For me, it was develop a personality or have a podcast. And I was like, I'm just going to go with the podcast. It's a lot easier.
We had Eric Bricker on the podcast, and I still think about this. He talks about physicians being autodidacts, that we are really good about how to teach ourselves things and learn things on our own independently. Just look at our 20s and 30s. We spent a lot of time absorbing information and consolidating it in our brains. We probably still crave that to some degree as well.
Absolutely. And that is, I was actually watching The Pit, and part of what made it kind of fun was going back and, every case they presented was almost like we were studying for an exam. You get these little vignettes.
Oh, it's an emergency medicine board's review course, essentially. Yeah.
And it was fun because I was like, okay, trying to guess what it is, what's the treatment, okay, what's the next step in the workup. Someone who's not in medicine, it was a screenwriter, asked us like, what, you guys aren't ER doctors, like, how do you know or think about these things? Why would you even know if it's not real? And I said, it's so drilled into us. We learned it. We studied so intensively that there are things that will not leave my brain. Like, I cannot remember my mom's cell phone number, but I can tell you like the first couple steps of the Krebs cycle. So, it's things that took up a lot of space in our brain. We really learned how to learn intensively at some cost. Cost. Yeah.
There's cost. You mentioned something about aging. When I was a younger physician, all my patients, or almost all of them, were older than me.
Mm-hmm.
And now that I'm 44, I'll be 45 in a couple months, I feel a little bit different about my patients that are now my age and I'm diagnosing them with really bad stuff.
Yeah.
Do you similarly feel a little bit different about
Oh.
yourself and your
Oh yeah.
relationship to your patients
Oh
now?
yeah. I know exactly where you're
tell
going
me.
with this. This is an ongoing struggle. Like we're getting to that age where it would still be sad if we just died of a heart attack, and it would still be shocking, but not too shocking. It wouldn't be so shocking that if something really bad happened to us that people would be like, well, we need to look into this. Is there some genetic abnormality? What's going on? It would just be like, oh man, that sucks. Next thing. Like we're at that point, and that is hard. And I will tell your young doctor listeners, every single time you hear from a patient, you look too young to be a doctor, suck the marrow out of those moments.
Record that. Get
Because
permission to record.
you-
I know.
You never know when the last time you're going to hear that is. And there will be a last time you hear that.
I will now admit, now that I'm old enough to admit this, I have a pair of glasses that I do not need. They're like 0.25, but I used to wear them on shift. I think my hospital ID still has, I'm wearing the glasses because I really resented that thing people would say, oh, you're too young to be a doctor. And I totally agree with you. People haven't said that in years to me. In years.
Yeah. People are like, you're the appropriate age.
Yeah.
This is about right.
You're about what I expected from a
You're what I
doctor.
expected. This all scans.
Do you find yourself giving different advice to patients now that you're maybe the same age as them, or you are in a body that is the same age as their body?
Yeah, I mean, I have a lot more empathy. That I think just happened with time anyways. But there is a lot less of just, you got to lose weight. It's not about that. Because one, the number necessarily isn't the most important thing to me. It's whether or not they're eating the way I would like them to, and whether they're exercising the way I want them to for their cardiac health and for their overall health. And I focus on that more because I also know it's harder as you get older. I recently started exercising for like the second time in my life. I got a gym membership, and I've been going to the gym every day for or 5 to 6 days a week. And I've been doing that for like a month and a half. If I had done this in my 20s, I would be like Chris Hemsworth already. It would be absurd. And now, I'm just, maintaining,
Hanging in there.
hanging in there. So I understand that a little bit better. And that is something I think we were all learning anyways in medicine. Really not to focus on the number on the scale, but it gives me a realistic point to talk to people about. I don't expect anyone to ever fully adapt a plant-based diet if it's not something they're into, if it's not something they're ready for. But I do think it is reasonable to discuss with them introducing more plant-based foods into their diet. Does every meal have to have meat? Can you maybe, instead of having 3 hamburgers a month that are, poor quality fast food, maybe save it and get one good steak? Is that a possibility? So I think I can come from a place that is actually a lot more reasonable. And in general, as I've gotten older, I code switch much less. I speak to patients the same way I speak to you. And I speak to my friends the same way I'm speaking to you. I think a lot of unhappiness in medicine in general comes from people that don't know how to be themselves at work. And they put on this affectation, and they're putting on their doctor suit. And I don't, and maybe that's good for some people, but for me, I like being able to speak normally. I feel like there's less tension in my brain, less cognitive dissonance if I speak to people the way I really want to talk to them.
I had a med school professor who told all of us in the room, like, hey, you guys are in med school, and the reason you're in med school is you probably have never had a real disease. And almost all of us were in our 20s, and that probably was true. I don't know every one of my med school friends' is past medical history, but the irony is that all of these people who are becoming physicians, to some degree, have to have been pretty healthy, that they didn't have some sort of disease, making it way more challenging for them to excel in school or focus on school. And so they actually have less experience with what it's like to have medical problems, to counsel the people who, by definition, have medical problems. And so in the same way, I have a way better understanding for counseling somebody about the challenges of weight loss or eating healthier or addiction or smoking or whatever it is, like, or just like that stuff hurts in your
Right.
40s,
Yeah,
like
right.
if a patient tells me, yeah, I've been trying to lose weight, but oh, it's so bad because my knees have been bothering me. It's way easier for me to understand what they're talking about because I'm like, I know my knee's been bugging me for 2 weeks and I didn't even do anything.
And the other thing I think about medicine and why this discussion about being a mid-career physician is important is because you know how it is. You're talking about being a young doctor, you're going to medical school. You're exactly right. We got there because we were relatively privileged for one reason or another, health, wealth, all that stuff, family that were able to support us. And to get to where you got, you really had to just put your head down, focus, and run through brick wall after brick wall until you got to where you wanted to go. And if you had stopped at any point along that way and really said, you know what? I need a moment of introspection here. Is this really what I want? Is this really what I want to do? If you do that, it's like you lose momentum. And then some people end up being doctors. And then they're like, oh man, I don't know if I really wanted to do this. I think we all know doctors who did that. Hopefully, most of them learned like in the first couple of years and did something different. But we know that there are doctors out there who didn't and who are now stuck in it. I hope those doctors, when they reach mid-career, are able to question whether or not this is really what they want to do and feel the freedom to do it. That's one thing that comes with being a mid-career physician is you do have a little bit more confidence that you can make things work out. You know that what we have is a job that can help, that we can always be useful somewhere. But you also know that you have a job that is always going to be in demand. I don't see it being replaced by AI completely anytime soon.
I think there's more opportunities now than there ever were before for physicians who maybe aren't, it's just not a good fit. Maybe it was a good fit, now it's not. There are way more opportunities for and recognition of a physician's skill set being helpful in other areas that are non-medical or medical adjacent too.
Yeah.
How do you distinguish between kind of just getting skeptical about the world or human nature or the healthcare system, like that interface between appropriate skepticism and cynicism?
Doctors are skeptics by nature. It's part of a good medical training is questioning, what you're seeing, what you're doing, looking at a study and being able to see it. How to avoid being cynical is a challenge. For me, there is an importance to being skeptical, and we should be skeptics. We absolutely should be skeptics. But when you become cynical, it's eating away at you more than anything else. And you do have to remind yourself that it's small. It's a slow change that can happen over many years. And we've all seen people who've gone from being like really enthusiastic, eager medical students to being cynical, burnt out docs. And I think we talk about mentors a lot, and we talk about people that we learned a lot from. I also tried really hard to learn from the people I didn't like and learn what I didn't like about what they were doing. What was it about their teaching style? And when I saw that when I was in training, I recognized that cynicism. And it always was something I would register. I'd always clock it and be like, that's not where I want to be. James Baldwin said this, and I'm paraphrasing. In this world, there's never as much humanity as we would like, but there's enough. And I think that is something I sort of cling to.
I like that. I recognized some cynicism myself again during COVID. ER doctor, probably no surprise there. But as I started to learn about it a bit, I associated that more with burnout, and that was actually a really helpful thing for me to realize. Hey, I need to take a step back or reassess my priorities or figuring out what I want to do with my time. I'll just say the three things that kind of come with burnout. It's exhaustion, depersonalization, and a reduced sense of personal accomplishment. So, if you're listening and you're hearing any of those terms, or one of the three, or two or three of the three, you probably are burnt out, would be my conclusion, my non-official diagnosis. But like the decreased sense of personal accomplishment is like the feeling that like, yeah, I'm a doctor, but literally nothing I do matters. Like whatever's going to happen to the patient's going to happen to the patient. I have no power to impact them, and so why even try? The exhaustion, I think, can manifest as like mental exhaustion or physical exhaustion. And then the depersonalization is like just kind of an indifference toward work. Like, yeah, you're just kind of phoning it in or just clocking in. And so I think like that when you were talking about cynicism, I remember feeling that kind of way and actually using it to help me recognize like, hey, I probably am burnt out and it's common and normal, but I should take some active steps to see what I can change to.
What I liked about the way you're putting it and the way you address it is that you're realistic about it. You're not being Pollyanna-esque, but you're also not being fatalistic about it. I mean, we can acknowledge two truths, that things are not perfect and that there's real problems, but that things can get better and that we can work things out and we have the ability to do that.
When I was burnt out, I you know, realized I was kind of doing, I don't know if I was doing too much. I'm always doing too much. But I was doing things that maybe I wasn't enjoying anymore. I used to write a monthly column in an emergency medicine journal. I mean, I did it for a decade and I used to really love it. And, my last probably year or 6 months or so, I was just like, I actually don't enjoy this anymore. So do you have any examples of things that you've let go of in your career or your personal life and maybe what that opened up or how that helped you?
There was a time when I was doing a lot of teaching of medical students, and it was that time where I was also pretty burnt out. It was around COVID time. It was a very busy time, very stressful time. And I think there was a point where I had to step away from it for a little bit just because I wasn't giving it the attention, I wasn't putting into it what I needed to put into it. And it was making me feel kind of bad about it. And I hate to say that because I do think teaching is such an important part of what we do. And I don't plan on it being a forever thing. I'm at a point now where I have that emotional bandwidth to do it, but I did have to step away from it for a little bit.
Yeah, teaching is great. It definitely keeps you young, probably in the same way that, you know, your kids help keep you young. Like it reminds you of your younger self as well. What have you learned from maybe a med student or a resident or a younger attending that surprised you or made you a better doctor?
Me doing this podcast has actually exposed me to, younger generations of doctors. Something I really appreciate about them is they will speak truth to power. And it's a phrase I'm not even entirely sure I understand, but I think emotionally I understand it. There's a lot of things that we do in medicine where you just do it. You just do it and you don't question it. It's what was done before and you just do it. And there are a lot of people who are like, no, that's not we're not going to do that. And the younger generation and I'm inspired by that. I think that's great. I think that's good for us to remember too. We should question, why are we doing this? Is this the right thing to do?
Sometimes I feel very different from, say, med students that are, 20 years younger than me. That's insane. But then sometimes I remind myself that they're actually very similar. Like, hey, we have an interest in, we both decided to go to med school and both decided to do XYZ. And that has helped me to like consider their perspective a little bit longer and hold it a little bit longer and see like, oh, maybe I am wrong. Like, I think maybe that's the other thing that comes with age as well, is a little bit more humility that like, yeah, it's possible I'm wrong. Maybe I have been doing this the wrong way for 20 years or thinking about the world in a wrong way. I mean, that's one of the best things about working with residents. And it probably is what keeps a lot of academic physicians in academic jobs as well, is just the opportunity to learn from them, have your views challenged, and also like it feels really amazing when I pull from my brain some factoid that I didn't even know was there anymore. That somebody asked me, well, why is the PR interval look like that? And like it's like robotic, like oh, well, it's because of the atria, blah blah blah, and let's draw out the His-Purkinje system, and I'm like, I don't use that in my clinical practice anymore, but clearly it's in there somewhere still, and I'm like, that is amazing. That it's in there too. My last question: I've had this idea recently that maybe an update or a refresh to the Hippocratic Oath might be interesting for modern today's 2025 medicine. So my question for you is, what might you add or change to make a Hippocratic oath like relevant or fair or better today?
It would probably be something about listening, being active listeners, better listeners. I mean, something that I've learned as I've gotten older is to just stop and listen and to let people talk, patients or other people talk. And I think that is important. As doctors, we are very good at diagnosing things very quickly, and we see patterns. We see pattern and we recognize them, both in medical and private lives. We see patterns, and we know what's going to happen next. It's something you do very well is actively listen. Just not with the intent of having a retort, not with the intent of anything other than just to listen and see where that goes. And I think that probably something we as doctors could benefit from.
Especially with AI coming to take over some of the listening. I'm thinking back to my esteemed medical school professors that said, like if you just listen, the patient will often tell you what's wrong. Well, Kaveh, thank you so much. It's been great to talk with you about a topic that I think is not talked about enough. Absolute pleasure. And yeah, I'd love to be on the podcast sometime soon. Thanks for joining me today. For interviews with physicians creating meaningful change, check out offcall.com/podcast. Make an account on Offcall to confidentially share your details about your work and sign up for our newsletter where you can hear more about the latest trends we're seeing in physician pay. You can find How I Doctor on Apple, Spotify, or wherever you listen to podcasts. We'll have new episodes weekly. This has been and continues to be Dr. Graham Walker. Stay well, stay inspired, and practice with purpose.